Your blood pressure is 150/90. You look at that number and immediately wonder, am I in danger? Do I need medication? Could I have a stroke? Was this just because I was nervous? And perhaps the most important question, what should I actually do next? If you've ever had a blood pressure reading around 150/90, stay with me for the next few minutes, because I'm going to explain exactly what that number means, when it should concern you, how to check whether it is genuinely high, and what you can do about it. And importantly, I'm going to tell you the situations where you should not wait at home. Let's start with the basics. When we say your blood pressure is 150/90, the first number is your systolic blood pressure. That's the pressure in your arteries when your heart contracts and pumps blood. The second number is your diastolic blood pressure. That's the pressure when your heart relaxes between beats. So 150/90 means systolic 150, diastolic 90, and both numbers matter. A blood pressure of 150/90 is above the normal range and falls into the hypertension range in major current guidelines. The 2025 American Heart Association guideline classifies a systolic pressure of 140 or higher, or a diastolic pressure of 90 or higher as stage 2 hypertension. Hypertension Canada defines hypertension at 130/80 or higher when measured properly with a validated device. But here's the part I really want you to remember. One reading of 150/90 does not automatically mean you have permanent hypertension. And that distinction is extremely important. Is 150/90 dangerous? The honest answer is, it depends. If you are sitting comfortably, feeling well, and you get a reading of 150/90, this is generally not the same thing as a hypertensive emergency. A hypertensive crisis is generally associated with blood pressure above 180/120, particularly when accompanied by concerning symptoms. So if you see 150/90, don't panic. But, and this is a very important but, don't ignore it either. If your blood pressure repeatedly averages around 150/90, that is high enough that it deserves proper medical assessment. Why? Because hypertension usually doesn't announce itself. You may feel completely normal, you may exercise, you may sleep well, you may have no headache, you may feel perfectly healthy, and yet, over years, uncontrolled high blood pressure can increase the risk of stroke, heart disease, heart failure, and kidney disease. That's why high blood pressure is often called a silent problem. Now, here's something many people don't realize. Your blood pressure is not a fixed number. It varies throughout the day. It can rise when you're anxious, in pain, exercising, talking, drinking caffeine, using nicotine, or simply sitting in a doctor's office feeling nervous. This is one reason we have something called white coat hypertension. Your blood pressure may be higher in the doctor's office than it is in your normal environment. And the opposite can happen too. Someone may have a relatively normal reading in the clinic, but consistently high readings at home. This is why current Hypertension Canada guidance recommends out-of-office blood pressure assessment to help confirm hypertension and identify these patterns. So don't let one number define your health. Let's get a reliable number. If you're going to check your blood pressure at home, technique matters. In fact, poor technique can give you a falsely high reading. Here's how I want you to do it. First, don't measure immediately after exercising. Second, avoid caffeine, smoking, or nicotine and exercise for about 30 minutes beforehand. Third, empty your bladder, then sit quietly for about 5 minutes. Your back should be supported. Both feet should be flat on the floor. Don't cross your legs. Rest your arm on a table so that the cuff is approximately at heart level. And most importantly, use an appropriately sized cuff and a validated automated upper arm blood pressure device. Then, don't talk while measuring. Take a reading. Wait about a minute, take another, and record the results. If you're trying to establish your usual home blood pressure, Current Hypertension Canada guidance recommends duplicate measurements morning and evening for about a week, using the average to assess your usual level. That gives your doctor something much more useful to work with than a single elevated value. Now, let's talk about something else. Why might your blood pressure be 150/90? Sometimes the answer is straightforward. There are certain factors that increase your risk of developing a high blood pressure. These are generally classified as modifiable or non-modifiable risk factors. So let's get into these. Modifiable factors. These are factors you can change, reduce, or manage. 1. Too much salt in your diet. Think of sodium as something that can make your body hold on to more water. More fluid circulating through your blood vessels can contribute to higher blood pressure. These often come from processed and canned foods. 2. Being overweight or carrying excess body fat. When your body carries more weight, your heart may have to work harder to supply all your tissues with blood. 3. Not getting enough physical activity. Regular physical activity helps your cardiovascular system function more efficiently and can help lower blood pressure. You don't have to become a marathon runner. Consistent walking, cycling, swimming, dancing, or other moderate activities can go a long way. 4. Too much alcohol. Regularly drinking more alcohol than recommended can raise blood pressure. Thus, reducing alcohol intake can be an important part of managing hypertension. 5. Smoking and nicotine. Nicotine can cause your blood vessels to tighten and can temporarily raise blood pressure. Smoking damages blood vessels and, when combined with high blood pressure, can substantially increase the risk of heart attack and stroke. 6. Poor sleep and sleep apnea. If you consistently sleep poorly, your blood pressure can be affected. Even more importantly, obstructive sleep apnea can contribute to hypertension. So make sure to address this with your GP in good time. 8. Certain medications and substances. Some medications or substances can raise blood pressure, including things such as some hormonal medications, ADHD medications, steroids, and so on can increase your blood pressure. So if your blood pressure suddenly becomes difficult to control, tell your doctor everything you're taking, not just prescription medications. That includes over-the-counter medications and supplements. Now let's talk about the risk factors for developing high blood pressure. They are broadly classified as modifiable and non-modifiable factors. Non-modifiable factors, as the name implies, are parameters that aren't within our control, whereas modifiable factors are those parameters that are within our control. Having these risk factors doesn't mean you're destined to develop hypertension. It simply means you may need to pay closer attention to your blood pressure. Point number 1. Age. As we get older, our arteries tend to become less flexible. Imagine a soft rubber tube compared with an older, stiffer tube. Stiffer arteries don't handle pressure in exactly the same way, and blood pressure, particularly systolic blood pressure, tends to rise with age. Point number 2, family history. If your parents or close relatives have hypertension, your own risk can be higher. There are genetic factors involved, but lifestyle and environment also matter. See it like this. Your genes may load the gun, but your environment and lifestyle can influence whether that risk becomes a problem. Point number 3. Sex. Blood pressure patterns differ between men and women across the lifespan. For example, hypertension becomes increasingly common in women with advancing age, particularly around and after menopause. Both men and women can develop hypertension. Point number 4, ethnic and background factors. Some populations have a higher prevalence or earlier onset of hypertension. Now let's get to the reason we're having this conversation. Why does high blood pressure matter? Imagine your blood vessels are a system of pipes. If the pressure inside those pipes remains too high for years, it can contribute to damage. Your heart has to work harder. Your arteries can become damaged. Your kidneys can be affected, and your risk of cardiovascular events, including stroke and heart disease, can increase. The important word here is consistently. We're not talking about one stressful afternoon. We're talking about blood pressure that remains elevated over time. And that's actually good news because blood pressure is one of the major cardiovascular risk factors that we can identify and treat. This is probably the question I get most often. Doctor, if my blood pressure is 150 over 90, do I need tablets? And the answer is possibly, but don't make that decision from one isolated reading. Your healthcare professional will look at your average blood pressure, how it was measured, your age, medical history, kidney function, diabetes status, cardiovascular risk, and other factors. But there is an important point here. Under the current 2025 Hypertension Canada Primary Care Guideline, once hypertension is confirmed, medication is recommended for adults with blood pressure at or above 140 over 90. So, if your properly measured blood pressure is consistently around 150 over 90, don't simply say, I'll just watch it for the next few years. That's something you should discuss with your healthcare professional. Now let's get practical. If your blood pressure is 150 over 90, what can you start doing today? Number 1, reduce sodium. A lot of sodium doesn't come from the salt shaker. As mentioned earlier, processed and packaged foods can contribute a large proportion of dietary sodium. Hypertension Canada recommends reducing sodium intake toward 2,000 milligrams per day, while emphasizing a diet rich in vegetables, fruits, and other heart-healthy foods. Number 2, move your body. Regular, moderate physical activity can help lower blood pressure. A practical target is around 30-60 minutes of moderate activity on most days, depending on your health and fitness level. You don't necessarily need a gym membership. Walking is a great place to start, especially whilst we are still in summer. Number 3, look at your weight. If you are carrying excess weight, even modest weight loss can improve blood pressure. Number 4, look honestly at alcohol. If you drink heavily, reducing your alcohol intake can lower blood pressure. Number 5, don't smoke. Nicotine can temporarily raise blood pressure, and tobacco use significantly increases cardiovascular risk. If you smoke and are struggling to quit, please speak to your GP, as this singular habit of smoking quickly escalates your risk of bad cardiovascular outcomes. Number 6, take sleep seriously. And if you snore heavily, wake up gasping, or feel excessively sleepy during the day, like I said, discuss sleep apnea with your healthcare professional. And finally, number 7, take prescribed medication consistently. I think I may need to do a separate video on this, as a lot of people get started on blood pressure medications, and as soon as the number is normal, they stop this of their own accord. Don't stop your blood pressure medication simply because your reading has improved. That improvement may actually be evidence that the medication is working. Now I want to make something very clear. 150 over 90 is not the number that usually defines a hypertensive emergency. The emergency threshold we're particularly concerned about is around 180 over 120 or higher, especially when accompanied by symptoms. If you get a reading above 180 over 120, don't immediately panic. Sit quietly and repeat the measurement after at least a minute. But if it remains that high, particularly if you have symptoms such as chest pain, severe shortness of breath, weakness or numbness, difficulty speaking, confusion, significant vision changes, or other new severe symptoms, you need urgent medical attention. The American Heart Association specifically advises dialing 911 for blood pressure above 180 over 120, accompanied by symptoms such as chest pain, shortness of breath, numbness, weakness, vision changes, or difficulty speaking. Knowledge is power. Take care of your heart. So let's imagine you are watching this video and your blood pressure today was 150 over 90. Here's exactly what I would suggest you do. Today, don't panic. Make sure the measurement was done properly. Repeat it after you've rested. Over the next 7 days, use a validated upper arm device. Measure your blood pressure in the morning and evening. Take 2 readings each time, about a minute apart. Record the readings and arrange an appointment with your GP, taking your blood pressure log with you. And if your average is around 150/90, don't delay that conversation. Your clinician may assess your cardiovascular risk, medications, kidney function, and other factors, and determine whether lifestyle treatment, medication, or both are appropriate. That is a much better approach than either extreme. It's nothing, or I'm going to have a stroke. Neither conclusion can be made from 150/90 reading. So, should you be worried if your blood pressure is 150/90? You should pay attention, but you shouldn't panic. One reading is a signal to investigate, not a diagnosis of your future. If your blood pressure is repeatedly around 150/90, take it seriously, because untreated hypertension can quietly damage your heart, brain, and kidneys. But the good news is that high blood pressure is treatable. You can measure it properly, you can identify the causes and risk factors. You can make meaningful lifestyle changes. And when necessary, there are effective medications. So don't ignore the number, understand it, confirm it, act on it. I'm Dr. Duke, and this is the medical context where we explain what your doctor may not always have had the time to explain. If this video helped you understand your blood pressure, kindly consider subscribing to this channel. And tell me in the comments, what's your blood pressure reading and was it measured at home or at the doctor's office? I'll see you in the next video. God bless.